Adrenal glands are odd. My guess is you probably don't even know where your adrenal glands are. Well, we're going to tell you. They sit on top of your kidneys. You've got 2 adrenal glands, one on top of each kidney, and your adrenal glands both have 2 layers, an adrenal cortex. Cortex, remember, is always the outside, and the adrenal medulla here is middle. And depending on the region of the gland, we can actually see different effects of the hormones. So hormones produced in the adrenal cortex tend to have long-term effects. Those produced in the adrenal medulla tend to have short-term effects. So here's my silly picture of your adrenal glands. The cortex, or the outside part, is associated with glucocorticoids or cortisol, testosterone production, and so on. These are long-term effects. The medulla, the center part, actually releases epinephrine and norepinephrine, again, antagonistic hormones. And what we look at is whether you're dealing with the cortex or the medulla, the hypothalamus and the pituitary gland are going to control both portions of your adrenal glands. Epinephrine and norepinephrine would be short-term, fast-acting hormones. And what we see is they're associated with either the adrenal medulla and our epinephrine, or our norepinephrine and our sympathetic nerves here. They're both produced by the adrenal medulla, but what we want to see is what they work on. So the epinephrine release actually works on all of these things listed here. So increased heart rate, increased digestion, coronary, so blood vessel dilation, bronchial dilation, and the ability of the muscles to actually convert and use glucose. So why would you have these things? The epinephrine, also known as adrenaline, and norepinephrine, also known as noradrenaline, are released into your bloodstream. They both work on nervous system response. They are critical for your fight or flight reflexes. So if your nervous system is going to respond, it needs these hormones to be released and to increase your heart rate, increase blood pressure, dilate your arteries and veins, dilate your bronchi so you can get more air in, all so that you can go through that fight or flight response. And when we look at this interaction, we are looking at direct effects on almost every target system in your body.